Imagine a bustling pharmacy in Accra where pharmacists are managing prescriptions, checking medicines, and helping patients like Amma and Kwame. Now, picture all that work being made easier with technology, computers, apps, and the internet. That's electronic pharmacy management, a system that uses digital tools to handle everything about medicines, from prescribing to dispensing, making it faster, safer, and more efficient. In simple terms, it is like switching from a paper notebook to a smartphone app for managing medicines. It helps doctors, pharmacists, and patients ensure the right medicine reaches the right person at the right time and also with fewer errors. One of the key parts of prescribing, how doctors tell patients and pharmacists which medicines to use. Let's see. The three types of prescribing. Prescribing is how a doctor, like Dr. Kofi in Kumasi, tells a patient what medicine to take. There are three main ways to do this, each with its own strengths and weaknesses. Let's break them down. 1. Manual prescribing, handwritten on paper. This is the traditional way. Dr. Kofi writes the prescription by hand on the piece of paper. This is how it works. Dr. Kofi grabs a pen and paper, writes the medicine name, dose, and instruction, and hands it to the patient to take to the pharmacy. Advantages: no tech needed. Works even without electricity or internet. Great for rural areas. Simple and familiar. Dr. Kofi doesn't need to learn fancy systems. Disadvantages: hard to read. Dr. Kofi's handwriting might confuse the pharmacist. Is that 10 milligram or 100 milligram? Easy to lose. Amma might drop the paper on her way to the pharmacy. Prone to errors. No automatic checks for mistakes like wrong doses. Example: Amma gets a handwritten prescription from Dr. Kofi, but the pharmacist misreads it and gives her the wrong medicine. 2. Computer assisted prescribing, typed and printed. Here, Dr. Kofi uses a computer to type the prescriptions and print it out. This is how it works. Dr. Kofi types the details into a computer, print a neat prescription, and give it to the patient. Advantages: clear and legible. No more guessing Dr. Kofi's handwriting. Faster for Dr. Kofi. He can use templates for common medicines. Better records. He can save a digital copy on his computer. Disadvantages: still uses paper. Kwame could lose it on the trotro. No instant delivery. He still has to take it to the pharmacy himself. Limited safety checks. It doesn't automatically warn about allergies or drug clashes. Example: Kwame gets a printed prescription from Dr. Kofi. It is easy to read, but he still has to trek to the pharmacy, and there is no alert if the medicine doesn't suit him. 3. Electronic prescribing, fully digital. This is the modern way. Dr. Kofi sent the prescription straight to the pharmacy online. This is how it works. Dr. Kofi enters the prescription into the computer and is zipped digitally to the pharmacy system. The patient just shows up to pick it up. Advantages: lightning fast. The pharmacy gets it instantly. No paper. No risk of losing it. Safer. Systems can warn Dr. Kofi about allergies or bad drug mixes. Easy to track. Dr. Kofi can check if Ajwa picked up her medicine. Disadvantages: needs tech. Good internet and computers are a must, which can be tough in some areas. Takes training. Dr. Kofi and the pharmacist need to learn how to use it. Privacy risk. Hackers might try to pick a sensitive information. Example: Ajwa sees Dr. Kofi who sent her prescription digitally. She walks into the pharmacy and it's ready. No fuss. Plus, the system flagged her penicillin allergy, so Dr. Kofi picked the safer option. Why electronic prescribing stands out? Electronic prescribing isn't just cool, it's a game changer. Here's why it's so special. 1. Fewer mistakes. No more misreading scribbles or losing papers. The system can catch errors, like if Dr. Kofi picks the wrong dose. Saves time. Ajua doesn't wait long at the pharmacy. It reads when she arrives. Better care. Dr. Kofi can see a patient's history and avoid risky drug combos. For instance, if Kwame is on a heart medicine, the system flags anything that might interfere, tracks usage. Dr. Kofi can check if Amma sticking to her treatment and nudge her if she forgets. But it's not all about smooth sailing. Tech troubles. If the internet cuts out, Dr. Kofi stuck. Learning curve. Older doctors might struggle to switch from paper. Cost. Setting it up isn't cheap, especially for small clinics. How electronic prescribing works. 1. Dr. Kofi meets Amma. Amma visits with a sore throat. 2. Prescription time. Dr. Kofi types it into his computer. The system checks for allergies or issues. 3. Sent instantly. One click and it's off to the pharmacy in Kumasi. 4. Amma picks it up. She arrives, shows her ID, and gets her medicine. No paper needed. 5. Follow up. Dr. Kofi checks later to see if Amma collected it. It is like ordering jollof rice online and picking it up. Quick and easy. In Ghana, electronic pharmacy management can transform healthcare. Reaches far. Patients in villages can get medicines without long trips. Local clinics connect to city pharmacies. Saves money. Less paper and fewer errors mean lower costs for everyone. Boosts safety. Catching mistakes early keep patients like Kwame and Ajua healthier. But there are hurdles. Internet gaps. Rural areas need better connectivity. Training needs. Doctors and pharmacists must get comfy with tech. Trust. People need to know their health info is safe. Electronic pharmacy management, especially electronic prescribing, is like giving healthcare a superpower. It makes prescribing faster, safer, and smarter. Whether it's Dr. Kofi helping Amma or Kwame picking up his meds, yes, there are challenges like tech costs and training, but the payoff is huge. As Ghana moves towards this digital future, more people will get the right medicine, right on time, with less stress along the way. You are listening to Zerit Podcast.